Welcome, everybody, to Learn With Lowell. Today, we're joined with Dr. Jeff Gross, who is a renowned expert in spines and a neurosurgeon. When asked for what he wanted to share in an exciting way today with all of you, he said, and I'm quoting, hopefully this was okay, I didn't clear him on this, that there are regenerative medicine options not just for longevity, but to help avoid joint and surgery spines, cancer therapies, and other treatments based upon our own natural biology. And we were just talking, and Jeff was telling me that he has a special thing that no one since the 1300s can claim. Jeff, what is it?
Well, I'm probably the only physician in the last few hundred years to have treated a jousting injury to the head.
Yeah, and what's the story behind that?
The story is that during my residency, when we were doing trauma call, there's a place called Medieval Times, and a trauma victim was brought in who, unfortunately, took a joust through his eye to the skull. And since we haven't seen those in a few hundred years, and our library did not have medical journals going back to that far, we had to figure out how to treat this jousting injury. So you don't see too many of those.
I imagine, 1300s, they probably didn't have a great survivability rate. I think back then they thought leeching was a great thing. What's like, how do you help someone when that's what happens?
Well, the modern approach, of course, is to take him to the operating room after stabilize and remove the fragments of the joust. He did lose his eye, unfortunately, but we were able to clean up the contents of the skull and treat him in the ICU for swelling and increased brain pressure for a while. But he did survive. So, but the interesting thing about leeches, if you'll let me go on a slight tangent.
Yes, go ahead. Yes.
Is that, it's very interesting. We always look back and say, oh, that was silly, leeches, but there is some anti-aging and survival enhancement when you donate blood, right? It's called phlebotomy, and it stimulates your own bone marrow and hematopoietic stem cells to kick into gear, which has longevity benefits. So indirectly, moderate leeching was probably beneficial to survival. And when they saw those results hundreds of years ago, they probably said, aha, these leeches are amazing. So there is some biology to back that up.
It's interesting. Is there a good ratio of how often you should donate blood? Because I love donating blood, but I don't. I just like let them limit me.
Yeah, I would say you could do it by a couple things. One is your actual blood count, and you could have sort of a range of when you build it back up, and then and if you donate a unit of blood and where that goes down to, so you have some numeric measure. But as long as you feel okay, you're not getting lightheaded and you have over donated, your bone marrow takes a good 3 weeks perhaps to replace what you've lost. So I would say I wouldn't donate any more frequently than every month. And most donation centers have their own guidelines. They may say every 2 or 3 months. So somewhere in that range.
What are your thoughts on like plasma donation? I know it's more involved. I haven't done it yet, but my only downside is that apparently if you donate too much, it looks like you've been doing heroin. And it feels like a thing that I should not look like I've been doing. So I've been holding off.
Well, besides the obvious benefit to our fellow men and women who need plasma,
At any point in this conversation, if you find value in it, please subscribe. It is hugely beneficial, and it tells Google and everyone out there that this is content worth watching. Thank you for everyone thus far who has commented, liked, subscribed, and told their friends.
We don't have long-term data as to the potential downside to giving up all those growth factors and things in your plasma. So you think about a plasma, you're kind of donating the watery contents of the blood, the fluid of the blood that's not the red cells. And it has proteins, growth factors, biochemicals, minerals, things we need. And we don't make those. So you have to supply a lot of those. Well, we make the growth factors, but the minerals and things we have to supply through our diet. So luckily, we have 5 liters of blood, a regular sized adult. So, you can afford a liter of plasma every once in a while and probably be okay. Just give your body time to catch up.
Do you think there is anything like, the leaching and blood with plasma? Like anything that gives you the indication there might be something interesting there?
That's a good question. The way that a lot of cellular biochemistry works is when certain receptors on cells don't get what they need, and probably when certain transcription factors for DNA aren't present, there is a response to produce more, right? There is a recovery or a reactive response. Most biochemistry is like that. And the response would be to produce more, just like I spoke to making more blood when you have low blood count. So I would say probably, but I can't actually speak to any one pathway at this time.
Makes sense. Yeah. So you in residency, something that when I read about the human body, when I read about these stories, what people can endure, the guy that like shot off his own arm, or like if you like fall too hard, like old people when they fall, and they like usually it's like a week later they die or something. It's like it feels like people are so fragile, and yet we also are like we can really regenerate and heal at the same time. But there's like like how as someone who actually is a medical professional versus just like reads and looks at these situations, are people really robust? Like are we really a robust species in terms of like our healing abilities?
I think during our optimal years, health wise, we
Mm-hmm.
are. I mean, we can heal. You can cut your arm, clean it, put a bandage on it, and watch it heal into a scar. I mean, it's actively sealing itself. I mean, it's pretty amazing. So I would say yes. I would lean. I'm in the robust camp of thinkers. Now, during our later years, as you lose muscle mass and bone density, uh, and of course, most of our stem cells come from our bone marrow. That's where most of them reserve. They're elsewhere, but that's where the big reserve is. As you lose bone density, you lose your stem cell, and that's when we start cycling into true senescence as an organism, not just as cells. So that's when we lose that robustness. And that's why when an older person breaks his or her hip and they become immobile for a few weeks, their chance of mortality skyrockets because they lose that robustness. So the way to maintain that robustness is to maintain your muscle mass and your bone density. And both of those are done, at least in part, through movement and exercise. We respond and maintain robustness reactively to our needs to maintain those physical demands. So exercise is probably the single easiest and cheapest thing you can do to preserve age, to live longer and live healthier.
I think when I was in college, I was taking neuropsychology. It was some with the brain. I got to cut into a goat brain. I found a tumor. The my professor was like, "Wow, that's really cool that you found that." And I didn't know it was a tumor. I was just like, "Hey, why does this thing look weird?" But anyway, in that they talked about how if you do aerobic exercise or like just like basic, like not like a hard thing to do for old people, that if they were already having like their brain decreasing in size, if they did exercise, they actually would start increasing a little bit. Like
Correct.
you get it back, which is kind of a powerful thing to think about.
Yeah.
You want your brain to be the healthiest, the idea that it's going smaller, and then it coincides with neurodegeneration of many different kinds. Like just like the exercise of itself, people always say like they feel better, but I wonder what the populations look like. I don't remember at the time because we didn't look at them for like younger people, like people up to 30s, 40s, 50s. When they exercise, what does it do to their brain as well?
No, not only does it support your health span through your bone and muscle, but it is cognitive protective. Your muscles release something called myokines, and we're learning more about tissues interacting with each other through uh, small growth factors or small proteins or peptides within the body. We know there's a relationship, for example, between the gut microbiome communicating with our brain, while our muscles communicate with most of our body too. Muscles are some of the most important tissue in the body. It's most of your mitochondria are in your muscles and your brain. So if you take care of your body and they take care of your cells, the cells take care of your mitochondria, and really that's what we're doing. Because the more robust mitochondria, the better they are at fighting off oxidative stress, slowing the senescent process, meaning preserving the cell age, keeping it as youthful as possible, and keep us as youthful as possible.
And just reminded me that you mentioned that bone density is like that has a big factor in how healthy you can be in later years. But women have like the weirdest bone densities as they age, like the osteoporosis and all these other things. Why is it that they live so long then? I don't know. This is like more like a hypothetical because like obviously we're still learning this, but women live longer, but their bones are like the most brittle or something.
Well, so I know you've had guests on that deal with cellular aging and tests for that, and I'm hopefully I'll overlap with what they said so we can converge here. But when you look at bone density, you're looking at physical exercise, hormonal maintenance, and probably vitamin D are the three most important factors. So, because I have a lot of patients come in and say, "Oh, doc, yeah, I take care of my bone density. I take calcium." And frankly, calcium is probably the least effective way to take care of your bones unless you're low on calcium, and very few people are low on calcium. So if your doctor says, "Oh, your bone density is declining, let's give you some calcium," that's not going to do the job in most cases. So back to the age process as it relates to bone density. When you look at a profile of age-related tests, women have a mortality benefit, meaning they live longer than men, outlast men until they're well into menopause. Then they correct back to the men, the male curve of longevity. But when you look at that overall, the women win out by a few years. They live longer by a few years because of that benefit during childbearing years. Because you think about it, as a species, once the women have to carry the babies. So as long as they can get pregnant and carry the babies, they should have the longevity benefit to then carry the children and rear them. And I guess men are just not as useful after after that. So at least species speaking. So I think that the goal here, one of the reasons tapping back into the bone density, is the hormones are so important, and this supports the whole concept of hormone optimization or replacement in both sexes. Is that those hormones are necessary to maintain that longevity edge.
How do you promote good bone density? Because my wife and she takes calcium supplements, and I take them too because I think it's fun, and they're gummies. But I don't think I expect any benefit from me. But I took some this morning. So how can I help make sure my wife's bones are good?
You should take her for an 8,000 to 10,000 step walk every day.
Mm-hmm.
Mix that up with some resistance work, whether it's the tough stretchy bands or weights or something. Mix it up. Stop on your walk and do a bunch of squats and things. Every day. Shoot for every day, of course. You not always be able to do that, and but and then when hormones begin to decline, optimize them with bioidentical replacement, and then for both of you. And then vitamin D3. We are heavily undernourished from vitamin D perspective in the world. So everyone should take at least 5,000 international units daily, unless there's some odd reason not to. And I've yet to meet the patient who's that person.
Is there an age? Well, how would I know when my hormones are getting lower? I guess. So I'm 31. So should I expect it soon? I know I'm not as energetic all the time as like when I was younger. I could talk a lot. Now I get tired if I talk too much. But so I don't know.
Yeah, I mean, and it's how you feel first and foremost. How's your sleep? How's your recovery from exercise? How's your energy? How's your motivation? How is your even cognition? You look at that and you say, "Hey, I'm not the guy I was in my 20s, in my 30s now." And then first thing you probably want to do is some lab levels of the testosterone panel. That's not just your free testosterone. It would be total, free, and there are a couple proteins you're gonna need to look at, like the sex hormone binding globulin, because that can suck up some of your useful testosterone. And there are a few other things you can look at. And the problem in the world is the lab values for testosterone go from 200 or 300 up to 900 or whatever, depending on the lab. So that's a large range. And when you're an 18-year-old man with lots of testosterone, it could be 900. And when you're an 80-year-old man, it could be 200. And the lab and And because, institutional medicine and insurance wants you to think you're normal, they say you're normal, so we're not going to pay for anything. But really, your optimal would be, maybe when you were 25, and we don't know what that number is because you never tested it, but maybe you sat around 750, 800. And right now, as a 30-year-old, maybe you're sitting at 500. And all we need is a little tweak back up to 600, 700 to get you to feel like you're a little younger again. But not only feel that way, it's everything anti-aging is anti-inflammatory, and having the optimal hormonal grind for your sex and your how you want to feel is supporting that anti-aging move. So we would tweak a little bit of replacement just to see how you feel and get you back to the way you felt good without going too far.
This reminds me of so I'm sure you're familiar with Bryan Johnson, the guy with the blueprint. And
Totally.
so one of my things that bothers me about what he's doing is that like he's really optimized for his own body biology, but we're all not the same body. So if anything, there should be an extra test for what he does, where it's like, are you a Bryan Johnson body type? And maybe we find like the 8 other different types of body types. I don't know how many there are, or like I imagine we're quite different. To make a different blueprint for each of those people, but I don't think they're like that's my concern. How do we find the individual precision medicine when we are diverse yet we're not very diverse at the same time from a population standpoint?
Well, we're poking at that all the time, and people like
Mm.
Bryan Johnson are helping us push the envelope, right? He's gone all in on this, and we're learning from him. And more, for example, you could get genetic testing on methylation, and that shows differences from person to person. And your B vitamin supplementation may require a different pattern than someone else. And we're going to learn that applies to other things too, like you just telepathed, right? We are all different. Maybe your metabolism in your cells responds differently to this and that. We look at that genetically now, and we're looking at it through cell markers, and we can look at it in some of the age-related tests and methylations and glycosylations, depending on the test, and we can adjust accordingly. Just like 100 years ago, we only had a few blood tests, and now we have thousands of blood tests. So you're right, and that falls under the heading of what we call precision medicine, treating the individual, and we do it based on the knowledge of treating the species, right? Treating the group, but we want to individualize it for everyone. And sometimes it's just a little trial and error. We move around doses of testosterone, for example, to find where your best fit is, or female hormones for your wife or someone.
Is there anything in what he's doing that you would critique? Or I mean, he listens to the show every now and again. He comments, which hi Brian, thanks for listening. Is
Hi,
there
Brian. Good job.
yeah, is there any advice you give to him for like people trying to build like such a blueprint for themselves?
Listen, I think I've heard Brian speak as well, and I think if I could speak, if I heard him correctly, he said, listen, not everyone has his budget, right? So you could get probably the vast majority of the benefits by the right exercise, sleep, diet, and supplementation. And you can do that inexpensively, if not with no additional expense, as Bryan Johnson, and probably get 80 or 85% of the benefit. He's doing some cutting edge things, and he's helping us learn from that. And I salute him. I do follow him as well, and I think he's right on. And you know what? You know what I like about Brian? He's got a sense of humor. People give him crap and all that, and he takes it and he gives it right back. And I like that about him.
Yeah, if people are following him, like it just seems like he's a lightning rod. Like everyone likes punching him and stuff. And it's like I don't know. But there's this one reporter guy that like followed him around on all these forums, like saying, "Hey, why don't you give money to this to this research? Why don't you give money to this research? Why don't you give the money?" It's like, why don't you go build a company, make $1 billion, and then you donate it to the,
Great response.
like, I don't know. It's like at a certain point, like if you follow him around and he keeps blocking you for asking such an obnoxious question, because I understand at a certain point people feel like if you're too successful, they think they owe a say in how you spend your money. But it's like show me a person that as a percentage, I doubt how much does that person donate. And at the same time, I don't mean to like cash shade on this person, but I'm like they could donate and help out too. But Getting off of a topic that might have people yell at me. Uh, a listener wrote in, and so I had my wife rewrite this, as I was telling you, because apparently they wrote it. So a lot of the commenters, you guys write things in a way that if I said them online, people wouldn't like it. So what advice would you have for women with larger chests that have back pain because of it? Is there exercise, foods, way of sleeping? Um, I know my wife in particular says like sometimes she wakes up and her lower back hurts like crazy. So like, what advice would you have for people like that?
Well, if you listen, most of us don't strengthen our spines.
Mm-hmm.
And let's talk about the spine structure for a minute, if I could expand on this. So
Yes.
you have over 600 muscles in your body. And if you were to go to the gym 3 or 4 times a week and lift, for half an hour, do some cardio and do some workout, you're probably not, unless you're in the small group, you're probably not adding your spine to that group. You're probably doing your biceps and your chest and your triceps and your big leg muscles, just the big ones in the extremities. But almost a third by number of our muscles are up and down our spine and what we call the paraspinal muscles. They go up and down either side of the spinal column. Some people call them the pillars, and they're sort of overlooked often. And most of what we do as humans during the day works against them, and they need even more attention, especially in the modern world where we sit in front of screens like we're doing now, and we sit in front of cell phones, which are here. If you think about it, everything's in front of us, and if it's behind us, we turn around and put it in front of us. So we're always sort of hunching forward and moving our neck forward and straining to hold it out, even though we don't know it. So what we're missing here is building the muscles up and down the back of the neck, mid back, and low back, especially if you're holding some additional weight in front of you, like ample breasts. So, one treatment is to downsize. The other treatment is to strengthen the heck out of your neck and upper back and lower back. And you do that through extension exercises, bending backwards. So many patients come to me with, neck pain from just chronic strain of the neck muscles, and I give them one exercise. And that's, take a break every hour from your work, put your hands interlaced behind your head and push back into your hands while your hands push forward. So there's no net movement. Okay. And if you do it right and you push really hard, you should feel it in your arms, shoulders, and in your neck. And if you can even do it really hard, you can shake a little bit because you really reach now you do that. So you feel it? You feel it? Okay.
Yeah. I was just doing it too for anyone listening.
Yeah, you're turning red here on. For those of you that are only listening to the podcast, he's turning a little red because he's working hard. But you do that for about 10 seconds, and you do 10 of them. Do 10 reps and do that every hour, and you eventually build up those cervical extension backwards muscles. And then for the upper back, it's a little harder. One thing you do is get a stretchy band, loop it under your feet, stand up, and use your back, your mid back to sort of arch backwards, which is kind of hard to do. It helps also. You can pull the stretchy band across in the front and learn to bring your shoulders back. So you build kind of the T shape. And then the lower back, and if it's also strained, you can get on the floor and do what we call Supermans, where you try to pretend you're flying and you lift your upper chest and arms and head and your legs off the ground, only your belly's touching, and you try to hold that for 10 seconds. And if you've never done it, 10 seconds is a long time the first go around, and you start to do reps of those. And you build up those muscles. Now, that's just the early simple version to do this. There are more advanced exercises at the gym. They have that bench that you can arch back on. Some people hold a weight when they do it. You can work up to that too, and that's good for the low back. And if you pull your shoulders back, you can do the upper back. Rows are really good. Row exercises for the upper back as well. Learn to bring our shoulders back, because we're a shoulder forward society these days. We're all sit at a computer, and shoulder forward. Or I when I used to do a lot of surgery, that was a problem as well. So that's what I would recommend, is to build up those muscles and improve your posture through strengthening those muscles.
So how many reps and then how often a week would you recommend they do it? Is this like something they should do in the morning when they get up, or is this every other day?
This is throughout the day.
Hmm.
I would take a break and do them throughout the day. I usually try to have people do, at least 3 or 4 times a day, the neck. It takes just a few seconds to do, 10 reps for 10 seconds, right? You take a minute break. You could do, I mean, listen, you probably look at your cell phone more than that. So every time maybe you check your texts on your cell phone, you could, oh, I should remind myself to do some of these exercises. The ones on the floor, you probably want to do at home,
Hmm.
at least number of reps and sets once a day, unless you have some situation where you can spread it throughout the day and break it up. But, just build up your own program. It doesn't matter as long as you're doing it and it's working. So,
Yeah.
and you can, you don't have to build on it by adding reps or sets. You build on it by holding it longer.
Hmm.
Yeah.
So it's not a so it's like a width thing. It's not a depth thing. No, it's a depth thing, not a width thing.
Yeah. Well, you're right.
At least
It's
depth
probably,
because you're holding it longer versus
it's,
like if you were to do multiple reps. I think that's width.
yeah.
This is semantics. I don't think that was helpful at all.
No,
At the
you're
comment.
kind of right. No, instead of lifting heavy weight, you're kind of holding it in static.
Yeah.
So it's an isometric of sorts, but you're right. It is the area under that curve of width and depth ultimately, but you can do this by building up the time, not so much the number of reps, as long as you have a decent number of reps, right? You could,
Yeah.
we're learning more about how to get more out of a training session, right? Like high intensity or VASPER for muscle, and how to stimulate, the mitochondria to survive better and release more myokines, which is of course good for our brain. You can do the same. You can learn from those things here. You don't need to do thousands of them. You just need to do them strategically to get the results.
So this is like a personal question. So like it's cool if like I need to like pay you or whatever. But so when I was a kid, I was in wrestling and this guy dropped me on my neck and it popped my neck. But I was a dumbass, so I didn't say anything. I just kept wrestling for until it healed. And now whenever I turn left, it kind of hurts a little. Is there anything I can do about that?
Well, you start with range of motion exercises.
Hmm.
So, a lot of people come and say, oh, it pops and things like that. What does that really mean? What really happened? Not sure. You could start with a basic x-ray somewhere and
Hmm.
see, did they injure one of the facet joint capsules or facet joints? And in reaction, did it form a spur, which limits you from moving that way or something? That's how I'd approach it.
Hmm.
And then, some good manual therapy, whether it's active release or massage or something, combined with a range of motion program, any way you like to do that, whether it's guided stretches, yin yoga, different things, and see if that starts to loosen things up for you. That's where I'd start.
Sweet. I'll give those a try. I know I've been trying to get into yoga. My friend sent me a new YouTube video, so I'm gonna be doing that as well as the exercise you just gave me today. And
Good.
so for equipment, I'm gonna get shoes later because but my shoes are so terrible that it hurts my ankles. My left ankle hurts when I walk, and then now my knee does, and then my left back is is tight. So I feel like it's time for me to get new shoes. Are there shoes, or how should I think about shoes, or anyone should think about shoes when they're trying to make sure that their spine is taken care of, or that they're not doing something stupid like I'm doing?
Well, listen, we're not perfectly symmetric as humans, right?
Hmm.
And if you see your chiropractor, you might be told, oh, one leg's longer than the other. And sometimes that's true. And it's usually subtle. But what happens is, and especially if you have one ankle's going out and then it affects the knee and up the posterior chain to your back, and then that song when we were kids around Halloween, the hip bone's connected to the,
Hmm.
it's true. So you gotta make sure you're getting good range of motion and stretching in all these joints, is because one of our hips may be tighter than the other, and that's pulling that hip and leg up into your pelvis, and the pelvis gets out of whack and it's affecting your back. So good flexibility means whatever stretching or yin yoga or something in that range. Listen, I want you to do lots of walking. I want you to get your longevity steps in every day, your 8 to 10,000 steps, which means you're probably going to seek out some good shoes with good cushioning. And if you're having those problems on one side, you could even do a little bit of an insert orthotic to help offload the overloaded side.
Mhm.
So yes, that means you're going to spend a little bit of money. You're going to get some nice walking or athletic shoes. It's not just going to be the $40 shoes, tennis shoes. You're going to have to probably spend over $100 on some really good shoes, but it's going to be worth it in the long run. And then there are even, I think, mail away services now for the insoles. So they send you this styrofoam thing, you step in it, make an imprint of your feet, and close it up, send it back to them, and then they send you custom inserts. And I don't have a reference or anything, but you can look and listen. The world is all Google now, so just Google it, and then or DuckDuckGo it, or whatever your favorite browser is. But and those you can use throughout many years. Like if you take care of them, you can take them out of one shoe and put it in another shoe and use it, and the combination of those things hopefully will take care of your problem. Otherwise, you're having asymmetric degeneration of the one knee, and it's affecting your back. And over time, it's like having one tire in your car that doesn't have enough air. And if over time, if you don't put air back in that tire, it's going to affect all the tires. They're going to wear unevenly. So you got to make sure you take care of that one tire.
Yeah, I've been trying to. I keep paying more and more for shoes, trying to get better shoes, but my shoes never last more than like 4 months because I do walk a lot, and so that's like the only. I lift weights and I walk, and shoes never lasted long. I don't know. I think they hate me. When I was a kid, I could get shoes to last to the point where my toe would stick through them, and I can't get them to do that. They just usually start cutting holes in my feet or start hurting me a lot. So then I just throw them out and get new ones. I don't know why that is, but for back pain, is like, so I look at the future. I hear my dad talk about certain things. I hear other older men talk about certain things. Is back pain something that is inevitable in terms of like, okay,
No,
because the nihilism bothers me.
no. So you asked me before we came on if I was a numbers guy or more of a stories guy. I think I'm more of a stories guy, but let's go with the numbers here. Um, there are 330 plus million Americans. And there's a growing aging population. So in the 70s, 80s, and beyond. The vast majority of those seniors don't have back pain or neck pain or spinal problems. The vast majority. Okay, so you go with the numbers and you're unlikely to. So the degeneration of the spine with age should, without being provoked otherwise, not hurt. So now, if you already have signs of asymmetric wear and some pain, we should get to it early. Low back pain, for example, is multifactorial. There's so many reasons for it. And it's not a one disease problem, even though big bad insurance companies give it one ICD-10 code and call it low back pain. It's a lot of different things, and it needs to be, addressed in a precise manner and looked at and evaluated. So that's most of my career. That's what I do, is I look at neck and back pain, second opinions. And I even sadly see people who have had surgery and they come in and said the surgery did nothing because someone looked at an MRI and said, oh, I can fix that. And it wasn't the thing on the MRI that was the problem. So we need to remember we treat people, not MRIs.
Yeah, but when my wife was a kid, she was in a car accident or something. So she got like a divot in her spine, so her lower back is like just terrible. But she got a scan again like a couple of years ago when her back popped out or whatever. She's a young lady, and they were like, "There's no dent there anymore." But it's like, why do I have back pain? And so I look forward to her doing some of these. Her doctor has her do like these. None of the exercises that you said today have been ever suggested to her. So I'm gonna. She's very excited. She was like, definitely ask that one lady's question.
Oh, it's those postural. Think about it. We're forward all day long. We don't need to work on the forward muscles at all. In fact, we need to stop using those because everything we do is forward. We need to work. The antidote is backwards for at least the neck and the lower back, and just the way we are, just the way we sit, way we act.
Yeah. And is there anything that we can do with like pillows or anything for like sleeping? I'm told like you put a pillow between your legs. I don't know. Is there like
And the problem with sleeping is we could fluff you up in a nest just right and put you just the way you should be, and then you fall asleep, and 30 minutes later your body's turned over into a new position anyway. So it's
hmm,
hard to stay there. They sell a lot of these neck pillows and things, and they're cool. They got a nice ridge and they help your posture. Now, it won't make you stay that way during the day, but at least decompress and relax the neck at night. But it's hard to stay on that pillow. It's hard to stay in that position. We don't stay in one position all night because we would get pressure sores. So our body has learned to turn around, move, change positions, things like that.
it does sound really incredible, the spine though. That so my understanding before this conversation was like, okay, my future, I'm not gonna, everyone's very like not in great shape. They never work out. Everyone who's in my family above me does not take care of themselves, and so you hear terrible things. And so I just assumed like terrible things are coming my way, even though I exercise, just because like it'll mitigate it to some extent. But the idea that the spine for the most majority of people just works well for the whole life is kind of crazy. Like, I mean, it's the central part of our body, but it's just kind of crazy that something can work so well for so long.
Well, yeah, again, you got to maintain it. So
Hmm.
there's recent evidence actually that the discs, the disc health, responds to a good amount of activity and loading. So exercise actually stimulates the end plates of the bones to improve the disc health. Remember, discs are not super alive. They're kind of biological rubber. Same with the knee and the shoulder, the meniscus in the knee. There's not a lot of cellular activity in there. So when we do regenerative approaches to help people with spine problems or joint problems, we're looking to enhance the biology of the stem cells that created that disc in the first place. And that's in the edge of the bone called the subchondral bone. And funny thing is, in someone who doesn't take care of his or her spine as they age, that tissue, that bone tissue, starts to look degenerated, and it's a replacement of that marrow, bone marrow, where a lot of your stem cells are, from a what's called a red marrow to a yellow or a fatty marrow. It's a fatty replacement. You can have that in muscle too, and we see that on MRIs. People that are out of shape have you know a lot of fat in their muscle. It's like going to the grocery store and buying a piece of marbled beef versus a very lean wagyu or something. So you want to have wagyu muscles, you got to work them out.
Mhm. But for regeneration, worked at I know some brain computer interface companies that they think that's going to be the first thing that gives people the ability to walk if there's like a spine damage of some kind. I've been, especially with Michael Levin and some of the new regenerative stuff coming out, I've been more excited about that approach where it like kind of like reknits everything together. How do you see the future going in terms of like what's really going to give people the ability to, if there's spine damage, to like heal it and stuff?
So let's separate spine into two components here,
Mm-hmm.
so that people understand. There's the neurologic component, the spinal cord, the nerves, and I think that's what you're alluding to in your question.
Mm-hmm.
Can you make
Yeah.
a paraplegic walk again? And then there's the structural component, the bones and discs, right? And most of the pain, not all, comes from the structural component. And when I was talking regeneration a moment ago, I was speaking to the structural component because
Mm.
that's, I think, easier, where we're already seeing some results in helping people to help them regenerate themselves, just like you would heal a cut on your body or something like that, or regenerate liver or skin cells or hair. On the neurologic side, there's some early work. Most of the early work, by the way, in the field of regenerative medicine does not happen in the United States. We're slowed and suppressed here for reasons we can go into if you like. But in China, there was a recent study in the last 3 months, or perhaps four, where they took paraplegics, they went into their spinal cord surgically and debrided the scar tissue. Debrides means to clean out, take away.
Mm.
And then implanted some type of stem cell biologics, I can't remember exactly what, and had some improvement, some early improvement. So it's an interesting thing. You can't just do an IV stem cell and get your spine to regenerate. But if we can remove the scar tissue, which sometimes acts as a seal or a barrier we can tap back into that tissue that needs to heal and let it heal without scarring over
Mm.
through the beauty of regenerative medicine. So I think there is going to be a resurgence in that activity in the neurologic side, and it's going to tail what's happening on the structural side, which we're already involved in now.
So I was talking to one of my friends the other day, and I think because I talk to really people on the cutting edge, I don't realize that like regenerative medicine in and of itself, like is on the more of the cutting edge of things. Like it's not a household thing. Like people don't like if I were to go to a hospital right now and I had like a tear of some kind, they'd be like, all right, you know, here's some basic stuff from like 20 years ago. And it's not to their detriment. It's just like it takes time for things to get in. But this is like really cutting edge stuff, but the science is still it's still supporting the cutting edge stuff, but we're still like you said, it's not prevalent in America, and I think it's because of the stem cell bans of like the early 2000s or something.
Well, you're right. We do have regenerative medicine in the US that's prevalent. It's called PRP, platelet-rich plasma. Most athletes or sports medicine or orthopedic guys are doing that for, tendonitis, tennis elbow, ankle strains, things like that. It's pretty prevalent now. And even, not that this should be a driving force, but some health insurance plans will pay for it, which is ironic because the FDA has declared jurisdiction on biologics, and they have not yet approved any claims that can be made. So that includes PRP. So, but insurance will pay for it. But then the same insurance company will say, well, we're not going to pay for any stem cell procedure because it's not approved. So they speak out of both sides of their mouth. And last quarter, United Healthcare made a $5.5 billion profit. So
And they laid people off too.
and they
They laid people off.
and I can't get an MRI for a patient of mine, because it's not approved, because I didn't put the exclamation point in the right place. But besides playing that game, the rest of the world regenerative medicine is not so cutting edge. It is embedded into part of the mainstream now. A lot of the things I do with patients with degenerative spine problems that cause symptoms or knees or other joints and other things with regenerative biologics comes from studies that are in Europe that have over 15-year follow-up. And a lot of the real cutting edge, the latest stuff comes out of Asia, China, South Korea. There's a lot going on in those areas, and they're ahead of us. And that's one reason, Lowell, a lot of people leave the United States to get stem cell procedures. You don't have to. We have it here. We're just not allowed to advertise it because we can't make any claims. So the places in Central America, Mexico, Colombia, what have you, they have an advantage because they can have a website that says we cure MS, or something like that. We can't say that.
Mm-hmm. Yeah, a friend of mine went to South Korea because I think she had I think it was macular degeneration, and they had something that would actually they could inject in the eye, and she went from being able to see like fuzziness to actually being able to read, big bold words, which is a massive quality of life difference. But the fact that she had to fly, 5,000 miles to do that is kind of ridiculous. Yeah.
Well, it's politics and follow the money, right? There are companies in this country that would lose a lot of money that sell drugs and implants if we could run free with regenerative biologics.
I was watching this, like, I don't know, it's a documentary or something where Mike Tyson was talking. He was getting ready to do like a fight, even though he's really old. Not really old. He's a normal aged older man. And just he's not in his prime anymore. That's what I really meant to say. I didn't mean to insult older people. And he said that they injected him with stem cells, and he felt like his body was just like lightning, and he could heal and do all these different things. Are you familiar with that type of stem cell therapies?
Yeah. So I'll admit that I've tried a lot of these things myself. So, we do IV approaches here in the Las Vegas office, and we've done stem cells, we've done exosomes, and I can tell you that, when you get stem cells, cells are large when you get them. They're pretty good size. A lot of them go in the IV and get hung up in your heart and lungs. So that's great for the heart and lungs, but it's hard to deliver them to the rest of the body with that kind of number. But if you get enough, it does feel like rocket fuel, as a friend of mine says. You feel your heart is pumping like it's ready to go. You know, the steam engine's ready to go up the hill for sure. That lasts about a couple weeks, and then you have a normal sort of regenerative anti-aging benefit, usually of just feeling better energy, recovering from your workouts better, sleeping better. Some people have better cognition, things like that. And these work by reducing cellular inflammation, because as we age, our body is busy fighting the world. It's busy dealing with stuff in our diet, stuff in our food source, stuff in our water, stuff in our air, whatever's in the electromagnetic fields, traumas, things like that. And it goes into a defense mode called chronic inflammation, where the DNA of our genes are in that programming mode. Our factories are in wartime mode, and that is aging. And the more that you have, here's your area under the curve argument again, the more that you have over time, the faster you age. So when you look at some of the age tests, it's a measure of that. How much methylation responds to chronic inflammation? How long are your telomeres? Is a measure of that, for example. How much your antibody, have glycosylations, and how those change. What are the patterns of that? So to flip that back, our cells back into that youthful, optimal, restorative, regenerative mode, like you were a little kid, you scraped your knee and it healed within days. That requires us going out of defense mode and into optimal, maintenance mode. Like it's like I just had my oil changed in my car. I got new spark plugs, man. It's humming like a baby now. That's what we want. So to do that, we have to call upon different genes that we have, and to signal that, we need something to do that. And that's what a lot of these biologics, stem cells, exosomes, and things do, is they help our cells flip back into that optimal mode. And when they're in optimal mode, they can go back to regenerating and not degenerating, because chronic inflammation is degenerative. And the alternative, this youthful mode, is regenerative.
Is there anything out there that's like better than what better would be? So instead, like kind of like a super soldier type serum, where instead of just being like your best that you could have been, it like soups up to our regeneration and everything else going on. So I mean, Steve Rogers doesn't exist, obviously, but I'm just kind of curious, like anything that's kind of like would make us even better, like almost like Wolverine or something. I think that'd probably be like a
No,
great
there
example.
are. I mean, listen, we both know that this is being done, confidentially by government agencies and military agencies, right? And they are using peptides. Peptides are, as you know, small protein molecules that can help influence which genes are called upon. So combinations of biologics like stem cells and peptides like BPC-157, and some of the other ones that are being called upon can optimize someone's cells. And if you start young, like you take a young soldier and you keep giving him this stuff, early, then they can maintain their battlefield readiness at the highest, physical levels, long term. So this is being looked at, I'm sure. But for those that come to me and want sports performance optimization or just biologic optimization, so they can, the more anti-inflamed you are, the longer those cells will maintain their youthfulness. You're pushing out your old age, and you're filling it with health, and that's called health span, right? So first you push out the years, then you fill those years with more youthful biology. And if you do that, you stave off or delay disease, because most diseases are accumulation of degeneration. Alzheimer's, MS, they all have an inflammatory component. Cardiovascular disease, even type 2 diabetes has an inflammatory component. So all of those can be delayed potentially, or even pushed off. And one of your guests has talked about, damage repair. Well, If you have damage, yeah, you want to repair it. But if you can push off that damage from accumulating to the point of disease, then you're delaying disease formation. So in response to your, underlying question, yes, we can optimize. We can do that. It's people do it. The biohackers and the anti-agers like myself, we seek that. We do it and we enjoy it. And we measure it. We have these age-related tests. We can measure the cellular aging and the physiology of our cells, both with DNA markers and intracellular markers and with bloodstream markers.
What's the difference? So like right now, I don't really do much other than just exercise and eat well. If I were to get hurt versus like someone doing all the stuff that to be doing, like what would be the outcome difference? Like what would that look like?
Well, this would be hypothetical because we don't have
Yeah.
this study because the FDA doesn't want us to do them. Plus, no one would want to be on the placebo side of that study, right? So I don't think it's a study we're going to see anytime soon. But
Mhm.
I think you would have a quicker recovery to an injury. I think you would have a quicker rehab. Listen, most guys in the regenerative space, even in this country, you can also talk to the guys in Mexico and Central America, that we all treat athletes. In fact, some of us have professional athletes that we're not allowed to name, and those guys will tell you how quick they recover.
Mm.
They don't want their employers to know sometimes about little injuries because they miss a game, they miss dollars,
Mhm.
or they'll miss more jersey sales or licensing fees. So they need to get back in the game as soon as they can. And there are outspoken athletes who years ago left this country to get treatments. Peyton Manning, Tiger Woods, others. This is not. They don't do it just because they think it's good.
Mhm.
Yeah.
There was a movie called Friday Night Lights, I think it's called. It's about Texas, like a sports town. There's a
Yep.
guy that was the star athlete, and he got his knee hurt. And instead of giving it the time it needed to heal, which was a while, it was like a month or so. I guess it may, I don't know, a while or a short amount of time. I don't have the frame reference. But then he played on it again before it was like completely ready, and he like popped it, and like he could never play again. And I just wonder like these type of therapies going into that type of person. Are we talking like instead of like a month of not using it, talking like maybe like a week? Like how big of a improvement are you
It
seeing?
depends. It depends. If it's a strain or sprain, I've seen acute ankle injuries heal within a week.
Mm,
But if you had a very, very minor strain, it might heal in a week anyway. So it's hard to know because you don't have a controlled study,
yeah.
of 1,000 ankle strains with, exosome injection versus a thousand without. So, um, but people sometimes need to do everything they can to get back in life and not be disabled and stuff like that. So in Friday Night Lights, yeah, I was an incompletely healed, predisposed knee. I'm sure they dramatized it for the movie, and I don't know exactly what happened. They probably relied on it too much and caused other parts to be damaged because the original injury was not fully healed. Right, it's
Mm.
weakened. So yeah, regenerative biologics have the ability to help us heal faster, better, stronger.
Would it also have the potential to help people get healthier faster? So like I think, it's the New Year's and a lot of people, make all these goals and stuff and then they give up real quick because it's like losing weight, right? Like a lot of people they won't see any difference even if they're, tracking on the scale for like several months before like everything like builds
Right.
up. But it sounds like if it like building muscle is just like you tear and then it heals, it tears and it heals.
Right.
So if you had like systems like this, I imagine it could probably like come in there and help people get healthier even faster too. Not even just like disease or damage and repaired. But it sounds like it would help people go from like, hey, I want to do better in my life to actually getting better faster.
Yeah, no, you're right. You're extrapolating from structural injuries to organic problems, right? Metabolism, pancreas function, liver function, all that stuff. And we see that we have examples. None of what I'm speaking to here is supposed to be medical advice for any individual, but I have anecdotally, I have clients who have come in. They were worried their kidneys were failing. They were worried they were going to have dialysis, and we did some IV approaches, and they have been able to avoid that for years, avoid dialysis. So we know And we watch the kidney numbers and the creatinine improve. We have a sweet woman who was pushing 80 a few years ago, and she had this lifelong diagnosis of rheumatoid arthritis and aches and pains and trouble using her hands. And we did IV exosomes, and of course, this is structural again. And we helped her significantly. She was able to do her arts and crafts and stuff. And she came back in 2.5 years later saying, hey, I'm starting to get that problem again. It's coming back. And we did it again, and she had another great result. So we've had people improve their physical performance, had improvements in HRV, heart rate variability, in the super athletic people. We've had, there are people with thinning hair that we have injected into the scalp and cosmetic issues. Here's a nice corollary. A pregnant woman typically has glowing, perfect skin and very few aches and pains, except maybe her lower back. Mm-hmm. And the reason for this is she's getting a 9-month dose of stem cells and exosomes. Right? She has a factory in her womb producing these, and the exosomes are small enough to cross out of the placenta and go into her bloodstream. So she's getting a 9-month dose. And you can ask ladies who have been pregnant, how was your skin during that time? How did you feel? And it's interesting. It's a little bit of a measure of how those treatments are. And in terms of other, disease, slowing or abatement, the organ, all of our cells, whether they're liver cells, kidney cells, structural cells, don't want to be in that inflamed mode. So anything we can do to put them back into the optimal mode through regenerative biologics, stem cell medicine is theoretically and practically beneficial.
We've mentioned this several times, and I actually in our pre-exchange you said something. I'm going to quote you directly because I want to talk about exosomes. But you said, I am one of the few people who thinks that stem cells are yesterday's longevity trend in the area of regenerative medicine. I'm a proponent of stem cell derived exosomes. So let's break that out. What are stem cell derived exosomes? Because we keep referencing it for people who don't know what are they. Yeah. Why are you such a proponent?
All right. So your audience likely knows that stem cells are these basic building block reserves of cells that we have that created us in the first place. And the ones we maintain as adults and call upon when we need them for healing, they become less effective with age because they're exposed to the same stuff our cells are exposed to. And those cells can only do so much. They can divide into a liver cell or a kidney cell, or they can help regenerate a scar or help you heal or fight something, but they can't make a new person, right? Those are more potent cells from the embryo. We don't tap into those embryonic cells here. We're just talking about end stage, mesenchymal stromal cells, MSCs, and these are what our body carries around. You can harvest them from your own body by usually going into your bone marrow or into your fat. Now, I'm not a big fan of the fat ones. They are a decent source, and there's a lot of good work with using fat-derived stromal cells or stem cells. But if you're obese, that tissue is inflamed, and I don't want inflamed stem cells. And why is that? Because cells signal to other cells. There's a lot of gossip among cells, and they do this through small particles. Some of them are just little proteins and peptides that go from cell to cell and bind receptors, and some of them are actually a little bit of a teeny bubble out of a cell with a little bit of membrane that goes and is incorporated into a new cell or a neighbor cell. It's like a neighborhood watch program, okay? So those cell-to-cell signaling particles, because it's really not, it's really like a mini cell, are called extracellular vesicles. And for cute short, we call them exosomes, E-X-O-S-O-M-E-S. Each exosome is about 1/1000th the size of a cell. And since a cell is measured in diameter in micrometers or microns, and 1/1000th of a micron is a nanometer. These are measured in nanometers and often called nanoparticles. And as it turns out, if I were to give you right now, Lowell, an IV dose of stem cells, whether I got them from you or from a more youthful source that's ethically sourced and screened, they would only last about 10 to 14 days. Cells turn over. They die and get consumed and recycled. But the benefits from that cell, what that cell does for your body, may last weeks or months or more. And so the question that we should all be asking is, well, how is that? If it only lasts 10 to 14 days in my body, how is it lasting so much longer? Well, that stem cell is making exosomes, stem cell derived exosomes. And those exosomes are communicating with your stem cells and your regular cells, giving them the signal to reprogram, flip the metabolism from defense to anti-inflammatory. That flip is the exact regenerative benefit we're looking for. So you might think, well, gee, the stem cell is really just the delivery mechanism. The exosome is the medicine. And you'd be right. And this was figured out, probably 10 years ago. And exosomes started to be available separately. So I like exosomes for the following reasons over stem cells. One, I can get a more concentrated dose. Two, they don't get hung up in your heart and lungs. They travel better and penetrate tissue better. And maybe 2B is they can even pass the blood-brain barrier and get into the brain. So anyone with a neurodegenerative issue that wants to try getting some help or benefit from regenerative medicine is likely to get more of that through exosomes because they're so much smaller. 4, they're easier to handle and store. And 5, they're about half the price. And I'm sure there are other benefits, but we generally don't have to match tissue from a stem cell donor, but we really don't have to match it from an exosome donor because exosomes have really minimal, if any, surface markers or proteins that declare them unique or individualized, like a blood type. So I'm a big fan of exosomes for that reason, and I use mainly exosomes in the work we do involving regenerative medicine here in my clinic.
A lot of this regenerative medicine stuff that we've been talking about today, there's this like kind of like Bryan Johnson feeling I have where it's like, man, I wonder what it'd be like if I just took some of this stuff like once a quarter. How quickly would I heal and do all the things I want to do? Like I imagine the results because I'm trying to lose weight. I'm chubby right now. So I imagine all these things would be quite nice, a little easier on me. Is for sports medicine. Do you have people who do like preventative version of this where like they take this stuff regularly just so that they don't accumulate?
I'm one of them.
Okay.
So we have a kind of biohacking group, if you will, people that do this periodically when they're in town. And I do it about 4 times a year. You said quarterly, and that's probably right on for my own response. So I get a good 2 to 3 month response with energy and with how I feel, and I know it's doing wonderful things at the cellular level for me. I can tell you the first one had more of a pow, more of an impact, more of a wow. After that, I've got it kind of at a maintenance level, so I don't always feel the wow, but I'm okay with that because I know what it's doing. So we have people that understand the benefits and do that. And I've done stem cells and I've done exosomes. I could tell you that except for that first 2 weeks of like what Mike Tyson said, where you feel like rocket fuel, that from weeks 3 to 12, it's about the same as getting an exosome dose. So exosomes are a lot easier and again penetrate the body better. They don't get hung up in the heart and lungs because they're so small.
Is there how affordable is it for like the average person? Is this like something that like sports people would or like doctors like yourself would be able to do, or is this
I don't
like,
mind. I don't mind telling you. In the office here, we have IV exosomes. Full particle count is 520 billion IV, which is, as far as I know, the largest single dose you can get, unless you did multiple doses, which I haven't, at the same time. And we have that under 4,000. uh, for a single treatment.
Hmm. It's not that bad. I was expecting like 20,000. Well, I'm looking into pharmacies a lot right now because they've been pissing me off, especially pharmacies
You
in
and me both
particular.
for years.
Yeah, yeah, especially like I might be making a pharmacy because how much they irritate me. Because there's I have we can talk about this later, but they bother me a lot. But the cost for like specialty medications is like on the low end like sometimes like 20 grand and on the high end like 100 grand. It's like wow, um, this stuff can get really expensive. And so I was expecting something in that ballpark. So like 4 grand is pretty pretty achievable for like
Yep.
not for the average American, but like you could see that it's less than going to the moon, in terms of like these like Starlink
No,
type stuff.
well, we've priced the IV to get people going in the door and get them interested and so they can try it out. We want that. When I do joint work, we do it or spine work, we do it at a local surgery center, and we have sedation because we do go into the bone, um,
Hmm.
and the cost of the center and the anesthesiologist for that twilight sedation and stuff, and how many doses we use. Things can go up from there, right? And
Yeah.
I have people come in for makeovers, right? We got 2 knees and a shoulder or whatever. We do a lot of combined things. So the price can go up for there. You're right, though. It's you can pay a lot of money for stem cells. Even places out of the country charge a lot of money. It doesn't need to be that way. And if you do have an HSA or FSA plan, health savings account or flexible spending account as part of your health plan, you can use that money.
Hmm.
And there's a tax deduction on healthcare after a certain cutoff of your adjusted gross income. So a lot of people can use it as a deduction as well.
Interesting. The what you mentioned you have like a level you go to and some people like stack and do multiple doses in one to get like above that large number you said. I think it's like 4 billion or something. What is the value? Is there okay, so there's two questions there. One, is there a lethal dose? It's like is there like a point where you should like maybe stop? And then or is there a point of like diminishing returns? Like those are my questions.
Good question. We don't know, is the honest
Hmm.
answer. So, in terms of lethal dose, I've never given anyone more than one dose IV at the same sitting. Um, so I've done multiple doses in bones and joints and things, but I'm expecting that based on the response and what we see on those, we have most of those stay local. And if I'm doing multiple joints, there is some uptake in the bloodstream. But again, think about the pregnant woman. She's probably getting a full dose, if not more, every day for 9 months. At the very beginning, maybe it's not a full dose, but by the end, she's getting a full dose, right? Every day. Those stem cells are kicking off exosomes every day. So I would say, is there a lethal dose? There's a lethal dose of anything you give enough of it, right? You can drink too much
Yeah.
water and die from that. So I think that there probably is. We're nowhere close to that. And
Yeah.
listen, we wouldn't ever get there.
Mhm.
We're so cautious with this stuff and so careful to make sure everyone understands that we every person is learning from it, and it's how they respond to it and how they feel. Yeah.
What does it feel like to, you know, receive it? Like in terms of like the injection? Is it
That's
like
just an
getting
IV.
like a yeah, okay. So that's not that bad. It's like a
No,
pinch and then you're done.
it's like you get a 500 cc's of normal saline. We put some vitamin C in there, um, and then you know it takes about 45 minutes to run in or so, depending on the size of your vein, and it's a straightforward process. It's pretty easy. Um, and some people feel something right away. Some people don't.
Mm.
The people with autoimmune problems, inflammatory issues, long COVID people, Lyme's disease, thyroiditis, things like that, they tend to have 1 to 2 days of flu-like symptoms because
Mm.
their cells have stored up all these pro-inflammatory molecules, and they have to be purged and released while their cell factories flip over into anti-inflammatory mode. So while you release those, your body feels like it's inflamed because they're circulating in your body, and it takes about a day or two for those to leave you. But I still think exosomes are probably the easiest way to deliver biologics this way. And you think about it, so many things in our we've been told by our grandmothers have exosomes in them. When you're sick, most cultures have some form of chicken soup, right? You make chicken
Mhm.
soup, and it's because you're sick and you want to feel better. And that's made from chicken stock, which is from chicken bones. And what's in the bones? The
Mhm.
bone marrow, the exosomes. You're getting a lot of those. How about the delicacy of bone marrow? When you go to a fancy restaurant, you can have as an appetizer, you can have some bone marrow. Super healthy. And then a lot of anti-agers and biohackers drink bone broth, rich in
Mhm.
exosomes again. And even
Interesting.
plants have exosomes that affect humans in a good way. So if you're doing a lot of greens or your green powders and things, you're getting plant exosomes. And a lot of, when you go back to evolutionary biology, we share some genes with plants and some DNA promoter segments and influencing which genes are called upon, and like heat shock proteins. One of the reasons hot sauna is so good is it causes us to release these survival proteins called heat shock proteins that help flip our DNA and our cell metabolism to make anti-inflammatory proteins to kill off senescent cells. That's a survival instinct. And
Mhm.
plants also have similar heat shock proteins. So we have these in common with many species.
So you take a lot of the therapies that we're talking about today.
I do.
Would you say now is like the healthiest you've been then, or is there like a point in your life that you feel like you're like more whatever more is?
I would say I am healthier now physiologically than I have been since probably for 15 to 20 years before starting this.
Hmm.
I think in your youth, unless you have problems, you're generally healthy because you haven't accumulated all the barnacles and damage on your cells that you have. But through my diet supplementation and focusing on sleep and other things, as well as the biohacking I'm doing, I think I'm doing well, and I'm due for some anti-age tests, see how we're coming along. But that's probably the best measure we have right now is some inflammatory markers like C-reactive protein and biological age tests, intracellular and blood markers like a glycan age test.
Is there anything that you'd like to see, with your background, with your history, your experience, that you think that there could be something there if people just put the resources to learn about it?
Yes. So what we didn't get into, and I'd love to whet your appetite, is there's
Mhm.
something called designer exosomes. Um,
Oh,
so when we get exosomes, they're generic, right? They're from stem cell derived, and they carry a stem cell signal to our cells to influence them, reprogram them, get them where we want them. Well, there is some work out of this country in designer exosomes where they're sort of overstocked with certain things like mitochondria. And you want to put on more muscle, maybe you need a mitochondrial heavy treatment. It's called mitochondrial transfer therapy. Or you want to lose weight, maybe you need some of those injected right into your fat tissue because you want to convert your fat from white fat to brown fat. Brown fat means it has a lot more mitochondria. And brown fat, every time you move, exerts more burning, more energies to do that movement. So your fat would burn faster. Brown fat burns quickly. It's also called brown adipose tissue,
hmm.
BAT. There is now we can't manipulate tissues here in the U.S. That's a no-no. So to make those, they may have to be manipulated unless there's a way we can filter or separate them without manipulating them. So there's work that needs to be done there. The other area, and I have a project of my own on this, is to separate out specific kinds of exosomes that come from immune cells that can help someone attack cancer. So that's my main side project at this time that I'm working on. And I look forward to hopefully making that clinically available in some form somehow.
What are you expecting the clinical, like the results to be of that intervention?
Well, I mean, I wouldn't be doing it if I didn't think it would have benefit, or I
No,
won't
no,
make
no.
the.
Yeah, yeah. Like, what's the significance? I want what I'm asking. Yeah, and then what
Well,
cancer?
if you could take immune cells, certain
Hmm.
T cells that are known to attack and kill cancer. The same cells that probably circulate around our bodies now and remove mutated cells, like under surveillance mode, and deliver them in a high single dose to a solid tumor, you could create an entire area of biologic immunotreatment of those tumors. So that's what I'm looking to do. As opposed to chemotherapies, radiation therapies, maybe even surgeries, we're now trying to figure out an injectable way to do this, which causes me full circle back to the spine, where we started, Lowell. If you look at spine, one of the reasons I went into regenerative medicine after 20 some years of being a neurosurgeon is I was frustrated. My patients were frustrated. They didn't want these big surgeries. There are really only two spine surgeries for the most part that spine surgeons do. We either decompress, meaning make more room for nerves, or we fuse. We lock bones together usually with metallic hardware. Now, often we do both, but those are the two categories to choose from, mostly. There are a few other little things, but mostly that's it. A lot of people don't want that. A fusion's still a pretty big surgery. It has its role, but I think it's been overdone for many years. And I and patients have been barking against that. And you don't have to have a surgery to have a fusion. You can have a fusion done through some strategic percutaneous injection techniques. So I'm also pushing the cutting edge of minimally invasive spine. We figured out that 40 years ago, maybe 45 years ago, if you had a fusion, you didn't have screws and rods. You just had bone graft. Mm-hmm. Well, you could do a bone graft now through biologics, such as bone morphogenic protein and some bone graft minerals, and cause a fusion without any screws or rods. And that can be done through strategic injection. And we have the policies and the procedures to do it. So you don't have to have what was done 40 years ago. You can have the newest and latest and greatest, and you have to ask. You have to ask your doctor for every option. And if your doctor doesn't talk about regenerative medicine or doesn't talk about needle-based techniques instead of open surgeries, it's okay to get another opinion or a third opinion or a fourth opinion until you've heard everything so you can make the best informed decision yourself. Because people don't want those big open surgeries if they don't have to have them.
Yeah, it's they're just the healing of them are ridiculous. Like, I know the open heart stuff that they have to do. They used to just they would basically cut you open like a fish. And then, the healing of that, all the complications are ridiculous. Then I imagine it's the same thing with the spine. If the smaller the area, the less likely to have infections and you have antibiotic resistance and all these other complications that come with that as well.
Right. Agreed.
Yeah. I got a two-part question. One, where are you going to learn all these things? This is really exciting stuff. The designer exosomes, microsurgery, precision surgery to do these new interventions. Where are you going to learn this stuff? Are there conferences? Is there publications that you're where are the oases of good knowledge out there?
Thank you. So look, the world is at our electronic oyster now. Mm-hmm. We can go on internet, and I am a self-proclaimed nerd. I fought that label for a long time, but I am that, and I do go on the internet and I do pull up the latest research daily now. I have Google alerts that send me stuff and I link to it. There's a lot of phony baloney press stuff you have to go through, but when you get down and you open up the actual paper, the actual journal article, and you read it and you make sure it's decent, it's done right, and I draw from that, and I look at that and I'm following it closely. And again, a lot of the early stuff isn't American literature. It's being done in China or elsewhere. The most important studies I draw from the structural use for exosomes for structural improvement, where we do have examples where we have regenerated cartilage, is from the Dr. Philippe Hernagot out of France. And despite my 3 years of high school French, I probably mispronounced professor's name. Sorry. And they have over 15-year follow-up data published a couple years ago, hoping for the 20-year to come out soon. And they took knee knee patients, and this is before exosomes, they injected stem cells, and they have proven without a doubt that the best results come from injecting the bone adjacent to the joint, not the joint. So the bone are where your stem cells are. And if you want to encourage those factory stem cells to reproduce cartilage proteins again, you have to go to the joint. I'm sorry, to the bone adjacent to the joint. You think about it, our discs in our spine, our meniscus in our knee, there aren't tons of cells. That's kind of the biological rubber. The activity that made that joint in the first place is the bone edge, where the growth plate is, the stem cells in the old growth plate area, called the subchondral bone. So that's the target. So I'm one of the few guys doing that method in the United States, but it's well described.
Yeah.
So that's part of where I go for the information. There was a second part to your question. I think I've already forgot to answer. It was where do I figure out how do these procedures? We devise them. And I think that comes from, surgical creativity. Like, how can I fix this problem without having to fillet someone's spine open?
Yeah.
Yeah.
Yeah. When you look at a paper, and I've recently learned that, it's like a master at something is someone who looks at like very few things very, very deeply. Like someone who's very new to something will just read the whole thing and not know to parse down to find the really important stuff. When you're looking at a paper and you're looking at something for new, or any example you want to go here, what do you look at to know if this is something that's interesting?
Well, I look at what they were trying to do, and sometimes you can tell. Unfortunately, medical literature is horrible now. The peer reviewers are not doing a great job. There's a lot of crap out there. There are a lot of poorly worded papers, or sometimes a paper has 4 experiments in the same paper. Should have been 4 papers. But I look for numbers, first of all. Was this in 3 rats, or was it in 500 rats? Did you duplicate it? Could I do this study and get the same result? Can I duplicate the results? I look for the depth of the method section. And I think this is kind of the lost art of research, writing and research is the methods used to be the most important thing. Like, how did you do this? Tell me everything you did to get there. Now, someone along the way a few years ago started putting the methods like as a footnote. And it's like after the article, like, what are you doing? That's the recipe. I need to see the recipe. And if it doesn't explain it fully, I sometimes can't rely on it because they won't say exactly what they did. Oh, we took rats and we did the stem cells and they're better. Well, how did you give the stem cells? Where did you get them? How much did you get? I need to know every detail. So I think the more detail, the better. And then, you have to be real careful because sometimes they're afraid to draw conclusions, especially in the United States. They're afraid to say something because, thought police and all that. But it's how, what did they draw from it, and were they honest about the drawbacks? Because a good author will say, here's what we think we found. Here are the next steps to further confirm that, and here are the drawbacks. Like, okay, well, we didn't control for this variable, and I'd really like to. They'll give you the roadmap going forward, so you don't have to read into it too much. And that's someone who's honest and thoughtful in writing. So those are the things I look at.
Yeah, one of my strategies, and I say this just to see if you want to make fun of me or not, but I usually, if it's for a textbook, or textbook's like the easier example, but for papers I always start with the conclusion, because usually what they're up to. When there's persuasive writing, I feel like they'll try and slip so much in there to convince me that they're right. But if I know what they're trying to say the whole time, it's like, okay, now I know where like their biases are. Like, was their methods good? Was there research? Because there's sometimes people like assume stats, like a normal distribution of stats, like they don't actually like do like really good math equations, numbers. I forget the term I'm trying to say, but basically, if you look at the conclusion, you kind of reverse engineer to see if they were really overly selective. Like in college, I was preparing a paper for something. I was like, oh, we didn't get, like, it doesn't, the thing I was trying to figure out is not true. We can't present here. And they just like,
Right.
just let me look at the numbers for a second. And they like moved the R values around. It's like, oh, look, now you do have it. It's like, I mean, but it does, like, we both know if you look at it just right,
Yeah.
like, it's not right, right? Like, you're like moving the window. So I conclusion up, and then I work my way up. And then, like, if I'm, depending on like my rush, I read the first and last sentence of each paragraph to know like the context of everything. And then, but now I'm going to add methods to it because that's interesting. I didn't know that they've been like popping the method out because yeah, research was all about the methods. If you don't have the methods in there, you don't. Like, there's no purpose in reading what the heck you're writing about because
Yeah.
that's all science is. Science is literally without the ability to reproduce it. It's not science. That's the whole part of science.
I agree with you. It's yeah. I mean, listen, you start with an observation, and
Yeah.
then you try to explain it. You the hypothesis. So these days, you're right. I start with conclusion too. So I will make fun of you.
Mm-hmm.
Sometimes they don't even state the freaking conclusion, or they'll use this vague word modulates. A modulates B.
Yeah.
Well, does it modulate it in a good way or a bad way? Like, just say it. So
Mm-hmm.
the peer reviewers are letting this crap get through, and half of it's behind a paywall now. So it's the true objectivity in science. It's you got to make sure it's not funded by big pharma or something, and otherwise, I think you're right. That's how I would approach it
Mm-hmm.
as well. And unfortunately, if it's poorly written, I can't rely on it.
Yeah. 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 And then in our preamble you said that listeners can have if like we could get listeners to have another set of questions to ask doctors, which this is a huge thing to know even know how to ask a question to a doctor. And I mean this in the nicest way possible. Sometimes doctors can be like the most well-meaning murderers if you're not like, helping them because they're so busy, the high suicide rates. I want to be nice to them. But like there was a doctor once, I'm gonna go off a tangent. There's a doctor once that like injected me with something without telling me what it was. And I'm like, what the hell is that? And he was like, oh, don't worry. And then I walked away. And they came back, and I'm like having a heart attack. And they're like, oh yeah, that's a side effect. I was like, for what? For what? Jesus Christ! And I was asking the whole time. But what? So, what are some questions? What are some of these other questions that you'd have people thinking about when they're going to see their doctor?
Yeah. So look, unfortunately, due to the United Healthcares and the Blue Crosses and the other uh, insurance in air quotes, they shouldn't get to use the word insurance because they don't insure much
Mm-hmm.
out there who are sucking the money out of the system because there's plenty of money in medicine to take care of what you need. You just can't get it.
Mm.
And you're forced to get this insurance, otherwise you have a tax penalty. So uh, we're part of this, scripted money making machine for these companies that's governmentally supported. So I know, next time you call me, Lowell, I'll be buried in the desert for saying that, but it's and that's what we say out here in Nevada, buried in the desert.
Mm-hmm.
And maybe where you
Jimmy
live,
Hoffa.
you'll be like cement shoes in Lake Michigan or something. But um, the um, the whole thing you should be doing is making sure that you're heard and that your questions are answered. And you should organize those questions ahead of time. So if I could help you be a better patient, it's please don't expect your doctor to read your mind or read your body. Go in
Mm-hmm.
with, here are my symptoms. And don't bias them by saying, oh, I've got some other stuff I don't need to tell you about it. It's unrelated. It could be related. Let your doctor determine that. Doctors are pattern recognizers. And you have to give them the elements to draw the pattern. So if you have to go in with an organized sheet of paper and say, here are my symptoms, here's what makes them better, here's what makes them worse, here's when they come on, here's how long I had them. The more information you have that's organized, the quicker and easier that interaction is going to be. Okay. And then ask all the questions. Doctor, what are all my options? Okay. And if you don't get one that is, and the doctor may say, hey, here's the one I really think you should do, but we have a duty to tell you all of them, right? That's
Mm-hmm.
part of the informed consent process. So make sure that you hear about a regenerative medicine option. Whatever it is, doctor, is there something in the stem cell area that you could call it stem cell medicine? If your doctor says, hey, I'm not trained in that, I don't know, I respect that. Because years ago, that was me. I went back and got retrained and I did join organizations and go to conferences and get retrained into regenerative medicine because my patients were asking, hey, how about stem cells? I don't know. I never trained to do stem cells. I trained to do fusions and decompressions. If you need surgery, if injections and pills and therapies didn't work. But there are a great many people who are not ready for surgery, but the other things aren't working, and they're looking for something in between. And hearing it enough times, I said, okay, I'm going to go figure it out. And now we have something. We have a new tool. So if your doctor says, no, that's experimental or it's illegal or something, he or she's not up to date. Frankly, just not up to date. So it's okay to go get a second opinion, and you may have to go pay for a second opinion. But before you have surgery, at least, get a second opinion or someone that might be able to give you all of the options. Yeah. Those are my tips to be a better patient and get more out of it.
And one extra tip I'll give is if you sit down and you haven't said your problem yet, and they've pulled out the medical pad to give you drugs, maybe need to get a different doctor. You're a chop shop. That's happened a couple times, like a lot. It's disturbing, actually. All right, so time for rapid fire questions. If you don't have an answer to these things, just say skip. Okay. What are some books you recommend? They could be in the regenerative space. That'd be great. But it could just be things that you've read recently that you think are exciting. And if they're papers, that's cool too.
Okay. Well, listen, I've always loved, and I still love the 4-hour work week. It's made me more efficient as a person to get done what I need to get done. It has nothing to do with medicine per se, but it was brilliant in my mind. I love that book. Tim Ferriss deconstructs things very well. I've read a lot of his other books too. I read from different journals all the time, and I'll tell you this. In the last few decades, I have been disappointed by names like Harvard and Stanford and Mayo Clinic. They deserved their name at one point. I don't know that they've maintained it. I'm also disappointed by journals like Lancet and New England Journal. They just published, New England Journal, you say, what have I read recently? And I know this is rapid fire, but New England Journal published an article behind a paywall on testosterone replacement in men. If you have testosterone replacement in your mid or older years, the conclusion was you're more likely to get a fracture. That makes no sense, right? Because your bone density should be better. Now, did they do bone density measurements? That would be the outcome. Did they mention that men who take testosterone are more likely to be energized and active and more likely to hurt themselves in some sporting event or tennis or something? No. They overjumped the conclusion, and New England Journal got this out there because it's so exciting, right? They wanted the press piece. So I'm disappointed in those. So I'm reading more organic stuff these days from lesser known journals and lesser known names, because I think the names are just brands at this point.
Yeah, I've been working on making with all the guests and stuff that I have, like a tapestry of newsletters I get of like the most advanced stuff coming my way, and then I update people in the show notes who ask questions about them, and then they don't have to do that. Perfect. How much do you love prior authorizations on a scale of 1 to none at all? But no, I assume you don't like prior authorizations. They're very annoying.
Prior authorizations. Listen, I saw the problem coming 20 some years ago, and I had colleagues who had 2 or 3 members on their office staff who their job was just dealing with insurance companies. The insurance companies know this and love it. They bog down offices on purpose, because if they keep the doctor overwhelmed with that nonsense, that's a few more patients the doctor can't see, and overall a few more bills that the insurance company doesn't get, right? This is built-in obsolescence in a way. It's a rationing by hassle. And I decided I wasn't going to deal with it at all. I didn't pick the health plan. I didn't make the contract. I didn't sign it. I think people do better with a catastrophic plan and a high deductible, and they pay for their own healthcare, or they figure out some kind of HSA plan or something like that. Otherwise, it just doesn't work. So I hate, what's the highest in this? 10?
Yeah,
10 out of 10. I hate prior auth of 10. I don't even deal with it. I will give a patient, because I'm out of network, I don't do any of this. I hand a patient, like, here's what you have, here's what you need. Go to your health plan. It's your health plan. Love you, but go do this. You deal with it. and
Mm.
they can be that employee. I don't need to pay someone, have extra people on my staff just to make the insurance companies happy. And they know this. They put the onus on doctors, and doctors were largely too dumb to notice it when it happened. So it's a struggle because I have patients that want to use their insurance, and if you can get it approved, we'll do it.
Yeah, privatization's annoying in that it sounds like it's the insurance is like, "Are you sure you want to do that to a doctor? Are you sure? You sure?" And like, it's
They're
kind of rude in a way. It's like I wouldn't have ordered this if I wasn't sure. Like, what are you doing?
Oh, no,
Um,
and you know what they do? They make us get on the phone sometimes with what's called peer review, where we talk to another doctor. And that doctor's job, he works for the insurance company, his job is to deny it unless somehow
mm,
I can convince him. And they bog me down for 15 minutes waiting on hold for this guy, right? Because he's
uh,
busy doing all these calls. And those are a few more patients I can't see, or I have to reduce my time with a patient. I don't want to do that. No patient likes a short visit. No doctor likes a short visit. So I'm sorry, but I won't drink that Kool-Aid. Now you got me all riled
yeah.
up, Lowell.
No, I just started here, but I hate prioritizations too. I've been looking at pharmacies that will have someone on their staff deal with the prioritization for the doctor because it's just so much for a doctor to be responsible for. You want to see the patient, and then you have to like handle the
We're not
paperwork. And it's like,
responsible. We're not responsible for that. How did we take that on? I don't know.
well, also it's like I don't know how they make money because I go to see my doctor, they get a certain amount from the
They don't.
insurance. And it's like, how is that
They don't.
sustaining them?
They
I
don't.
feel
So
terrible because they're doing a great job too.
private equity has been buying up doctors' practices. Most doctors are now employed
Mm.
by some company or some health plans, and it's pushing the problem into the hospitals and health plans, and they are now struggling financially. We will hit bottom here within the next 10 to 20 years with this.
Yeah, I think I was thinking about this the other day about downtowns and how like the downtowns are basically cultivated for like older people, and that like older people aren't really buying things in the downtowns anymore. So I wonder what downtowns are going to become as like people my generation don't buy things. We don't really
Right.
care. We have other things to do. But yeah, I should have started here. I like people really like it if I can find what irritates the guests to talk about that first. But yeah, we'll do a part two where it's just like things we hate about pharma. Uh, when were you happiest in life?
Gosh, in different ways, happy in different
Mhm.
elements. I'm really happy now. I've
Oh, it's
had a
great.
resurgence of my professional career doing this regenerative medicine. I was stagnating. I love doing what I was doing. I was doing a lot of second opinions, and I see a lot of people who have had surgery and they still have pain, and I would love to find the problem. I played a lot of Monday morning quarterback, so maybe it's not fair because I know what they missed, because I looked at it. But I also take the time to look at it, and I love that Sherlock Holmes piece to it, and I'm a little bit OCD, so I like to dig into the details. So I'm really happy. I have a feel good thing when a patient is, we can figure out a problem and we help them with the problem. So I'm
Mhm.
wired that way, right?
Yeah.
So I'm happy professionally there. I'm happy personally now. My kids are older, so I I feel that they are finding their own way. So that's a big deal. That's a success in a way. And I've always found happiness in different, even through struggles and challenges in different parts of my life. But I think now is some of the most exciting time.
Yeah. And then I'll let this be the last question because I know we're going over. But is there something you're looking to learn about right now? And bonuses, if it's a person that I can have on the show, I'll help you learn this. But yeah, what
Oh,
do you
wow, that's cool. Well, listen, you've had some really great anti-aging guests on the show and stuff like that. I would really love, to get some of these cutting edge scientists from out of the country who are
Mm,
doing the designer exosome work on, and see what because they're publishing now what they did a year ago, and they're researching what they're doing stuff now they're going to publish next year, but they've got stuff in their head that's probably 5 or 10 years out. That's what I want to learn about. I want to be ahead on the exosome game, and I think we can do a ton by using what our cells already can respond to biologically and naturally, just with a little bioengineering and a little good old-fashioned scientific know-how and elbow grease. So that's what I'd like to learn.
Sweet. And for everyone listening in, if you want to see a live stream version of this where we all ask questions, let me know, because this is something we talked about in the preamble, and your game. So if this is something people want to do, we'll make it happen. Then that will be the last question. Thank you so much for coming on today, getting people excited about the cutting edge of just healing their bodies, knowing what questions they can ask, helping out their backs. You helped me feel like the future isn't going to suck for me. And I'm going to do all the exercise you said as well. But thank you so much for coming on the show today.
Thank you for having me. This was fun. I hope we can talk again.